I'm joined today by Dr. Karen DeSalvo, who has practiced medicine for 20 years in Louisiana and most recently served as health commissioner in New Orleans and then as acting assistant secretary for health in the Obama administration until January of 2017. It's so great to talk to you. You know, we've been following the various iterations of Republican attempts to repeal and replace the Affordable Care Act, each worse than the previous in some ways, with some marginal improvements depending on where you look. From a sort of 30,000-foot perspective at this point, what do you think is the fundamental problem with the approach that Republicans are taking to these bills?
It's hard for me to stay 30,000 feet because I'll be honest with you, all I can see are the faces of the patients that I took care of over the years who were uninsured and who now I know are going to have to struggle again, go to bed worried that they're not going to be able to get the medicine they need or to have some bankruptcy issues. I mean, this is also not just about the uninsured, but I think the fundamental challenge that we're facing with this new approach is that it touches everybody in this country in some way. It stands to reverse some tremendous progress that we've made in the last 8 years to see that people have access to affordable health insurance, which gives them access to care and then health. And it's a pretty big step backwards.
One of the approaches I've taken is that if you start with Obamacare, which is really no progressive panacea, right? I mean, we're talking about, particularly when we talk about the individual mandate, this is something that was proposed by a conservative think tank during the 1990s. There's nothing socialistic in any way of mandating that tens of millions of people buy a product from for-profit companies. When you start with that, and then you look at the promises that were made by the current president of it's going to cost less, no one will lose coverage, and quality of care won't go down, it's just sort of impossible, right? I mean, there's really no way that you can take Obamacare, which is already not, as I said, far to the left, and go further right and do those things that the president said can be done. Somewhere, someone's either going to have to pay more or have fewer benefits or have a lack of access. From a mathematical standpoint, am I missing something there?
Well, you know, you're exactly right. The Affordable Care Act proposal was built upon principles that were considered to be, you know, sort of middle of the road, to build on the capitalist system that we had of private insurance and the private sector being able to deliver care, as well as sort of shoring up the safety net, and over time kind of get people to have independence financially to be able to shop for their care, so they'd have their own insurance product that would allow competition in the marketplace from the delivery system. So a lot of free market principles built in, but then a recognition that for a variety of reasons, the health insurance is unaffordable for many people. And we have to be attentive to this idea that people walk into the insurance marketplace with pre-existing conditions. I think there's also an interesting part about the Affordable Care Act that a lot of people forget, which is it freed people from needing to have employer-sponsored insurance, and freed young people up to the age of 26, you know, to be able to have coverage. So it changed not just the way we provided care for low-income people, it changed the way all of us receive insurance about, you know, pre-existing conditions and the affordability of the products, and sort of the way that we can anticipate that it's going to cover mental health, screenings, prevention. And so all of that, of course, was expected to cost more. And honestly, it was moving along the pathway as the budgetary expectations were, as we were bringing more people into the system. But even with bringing more people into the system, the Affordable Care Act was able to bend the cost curve. And this is really important because what we were able to do, and still are, is to see that care is not just available to more people, but it's more efficient. And this discussion about pulling coverage from people distracts from that opportunity to actually make care more person-centered and more efficient for people. Because at the end of the day, we all agree, I think, that we need to be more thoughtful about how much care costs, but it doesn't mean we should do that by taking it away from people. We should just make it more efficient.
Yeah, and there's some broader conversations there too, in terms of should health insurance companies, if we're going to have the type of system that we have, which I don't believe is the best system, but if we're going to have it, should there be health insurance reimbursements for outcomes or for each procedure and test and thing that is done by a care provider? That's sort of a different conversation. One thing I do want to ask you, because of the work that you're doing now, in my mind, have this initial reaction when I hear 22 million people are going to lose coverage, even if we take out the ones that will sort of lose it because they don't want it, right? Some people will no longer be forced to buy insurance and will choose not to. But if we forget about that, we forget about those who will be priced out because of the increased cost if you have pre-existing conditions or for all of the other reasons. Do they, in your mind, understand why that would happen? In other words, will there be political repercussions to those who repeal and replace Obamacare, or will it just be blamed on Democrats, as Republicans and Donald Trump have tried to do for months now? Will there be a price to pay, I guess is what I'm asking, if indeed millions of people lose coverage?
So two things on that, Dan. One is that the price to pay clearly is in the health of people. So no matter the political repercussions, as a doctor, as somebody who has been in this space for a long time, the data is pretty clear that health insurance saves lives and it reduces suffering, that there is going to be suffering and people probably are going to lose their life if they don't have health insurance coverage. And that's not, I think the second piece of this that folks forget is that most of the people who have benefited from what happened under the Affordable Care Act from an insurance standpoint are people who are working poor in particular, that have no way to access health insurance coverage and make too much even to be eligible in many states for Medicaid. And maybe I'd just add a third thing is we keep getting hung up on this 22 million number, and they're very important people. They're going to be, our patients and our neighbors and our family who are going to lose access to coverage. But the kinds of changes that are being thought about have repercussions that will touch everybody in this country. So, remember that, for example, more than half of nursing home care is paid for by the Medicaid program. That half of the babies in this country are born into the Medicaid program. So this is not a small proportion of our population that would be impacted if we make these kinds of financial choices in front of health choices. And I would just really like the conversation to stay focused on what this means for the health and well-being of our communities and the people that we know and love in our communities, including for docs like me, our patients.
Are you of the mindset that the employer-connected for-profit health insurance paradigm that we have can be, quote, fixed in a way that really works well? Or do we need to be looking at other systems altogether like most of our other developed country counterparts have?
No, I'll actually point to the American Medical Association, who in their recent Congress added a need to look at other models of financing healthcare, including single payer systems. So even kind of traditionally conservative physician groups are starting to say maybe we should at least look at the options. The reality is that we have a private pay system by and large that has some overlap with a public pay system. It's worked mostly. It's been working increasingly better for the last 8 years as more people have been brought into the system. So I frankly would rather see us in the short run fix what's wrong with the current system that we have, find ways to make sure that there are choices of products in the marketplace, that there are that we don't have challenges with out-of-pocket costs for people, but they actually can get access, especially for treatments for chronic disease when they have it. So there are plenty of ways that we could fix even the current system we're in, while we at the same time as a country think about what's the most affordable but most effective way to provide coverage in the long term.
Yeah, and that's one of those things where when I hear that, on the right, they'll often say, hey, premiums continue to increase under Obamacare. And of course, that's true, but they've arguably increased less quickly than they otherwise would have. I think it's important to fact check that when we hear that from the right. But at the same time, if the victory is, well, yes, it keeps getting more expensive, but not by as much as it otherwise might have, it still feels like it's a sort of Pyrrhic victory in a way. It's a victory, but we're still not fixing the overarching problem.
Well, I mean, we've been talking about fixing healthcare for a long time, and it is creeping up to being moving from being a sixth of our economy to a fifth of our economy. So it's clearly continuing to grow. On the other hand, you're right. The growth has significantly slowed, and even just in the big picture, we've saved at least $500 million compared to what we would have spent if we hadn't had the Affordable Care Act. So work we were doing at HHS and honestly a lot of innovation at the state level and the private sector as well has meant that we're getting the care system more efficient just as we're bringing more people in. So why would we want to stop, sort of that progress? Everybody's been working together because those are related ideas. You have to have a way to pay for care, but we want everybody to have something that's affordable. We spend twice as much on average per person in this country for healthcare as any other of our peer nations, and our return on investment is worse. And we have some of the worst health outcomes on the planet. And in fact, for the first time, recently we're starting to see some concerning numbers about life expectancy. So we don't want to stop with the gains. We want to keep making sure that we're making the care system better for people, but we want to keep bringing more people in.
Yeah, the life expectancy thing is something we've been covering, and maybe something we could have you back on to talk about in the future. We've been speaking with Dr. Karen DeSalvo. Thank you so much for talking to us about this today.
Great. Well, thank you very much for the time. I really appreciate it.